All right, Friday morning, joining us once again for a checkup on this week's health headlines is Dr. Iris Gorfinkel. Dr. Gorfinkel, good to see you. Good morning. We're going to start with measles because cases are on the rise right across the country, particularly in Alberta and Ontario, where cases are the highest they've been in over a decade. What is behind this outbreak and who should get vaccinated?
It's gobsmackingly bad. Think about it. In the decade from 2013 to 2023, there were all of 100 cases. Canada is now dealing with 600 cases, 500 of which are in Ontario. So they're mostly concentrating in Southwest Ontario, but it is a serious problem because most doctors have never seen a case, so it is underdiagnosed. And meanwhile, the vaccine is 97% effective, 2 doses. People born after 1970 need to get that second dose. They need to make sure. The hospitalizations we're seeing mostly are in kids because they are also, unfortunately, under-vaccinated.
Okay. I got my second dose last week because I was due for my annual, and my doctor, we had no record if I had gotten the second shot, and he said the blood work will show whether there is some coverage, and it showed it was indeterminate. So he said, let's get the second shot.
It's really super smart because if in doubt, the rule is vaccinate. So we're not recommending everybody get their blood test. We're saying if you're not sure, get your vaccine.
Right.
And for kids who live in southwestern Ontario, they're actually offering the vaccine earlier. Normally we wait till 12 months, but for children in that epicenter of the infection, we're giving it between 6 and 12 months to make sure they get that protection on board because their immune systems are perfectly naive.
Right.
They've never seen anything like it. They're more likely to wind up in hospital.
Okay. Let's talk about this other study that says marijuana users are 6 times more likely to have a heart attack than those who abstain from the drug.
Holy schmooly, is that going to be a major shifter? Because that study involved over 4.5 million people. And so most people think cannabis, natural, good. Hey, wait a minute. Isn't tobacco natural? I think it is. And what do they find? The risks for cardiovascular disease are probably higher than that of tobacco. And these are users. So that included edibles, smoking, so 6-fold increased risk of heart attack, 4-fold increased risk of ischemic stroke. That's the kind of stroke that comes from a blood clot. So we're talking about serious problems down the line, potentially.
All right, so some big news and a bit of a wake-up call maybe for some. Meantime, I want to ask you this as well about a new U.S. bill that would allow AI to prescribe medicine independent of human doctors. What are your thoughts on this? Is this a good idea, do you think, or is this a Gorfinkel quack attack?
I don't know if I'd call it a quack attack.
Okay.
So the smart doctor will use AI to her advantage. We don't want to completely dismiss it. But then on the other hand, what's to stop somebody from gaming the system? Hey, I know how to get my opioids. I know how to, game the system to get my Tylenol 3s, whatever drug they're interested in, morphine. So we've got to be really cautious with this stuff. And never mind, how much of the healing is done through what we're doing now? Remember the concept of human conversations and understanding? So it's not ready for prime time. And no, this isn't a bill in Canada. This is in the United States.
All right.
Right. Yeah, it seems to be so many pros and cons, though, when it comes to AI, and hopefully we can harness the pros, particularly when it comes to health and medicine, and use it for the better.
Hear, hear.
All right, we're going to have to leave it there. Thank you, Iris.
Thank you.
Okay.